Hi, you may be fascinated to know that bone marrow transplant is not a surgery and neither do the donor lose an organ. Hi, I'm Dr. Ankit Jitani. I'm a consultant hematologist and bone marrow transplant physician at Apollo CBCC Cancer Care, Ahmedabad. So today I'm here to discuss some facts, some points and give you some understanding on bone marrow transplant. We know in good detail what kidney transplant and liver transplant is, but bone marrow transplant is something which is not as old a medical form of treatment as the other form of transplants. In bone marrow transplant, the donor from whom we collect the stem cells do not lose an organ. The stem cells regenerate and fulfill what was there in the donor from before. Also, bone marrow transplant is not a surgery. There is no cutting or chopping involved in bone marrow transplant. The other names of bone marrow transplant are stem cell transplant or hematopoietic cell transplants. So we should not be confused between these three terminologies because all these three are the same. So broadly, stem cell transplant or bone marrow transplant are of two types. The first type is called autologous stem cell transplant, in which the source of stem cell is the patient himself or herself. We collect the stem cell from the patient, store it, and then we use it whenever we need to transplant the patient after administration of high-dose chemotherapy. Autologous transplant is used as a curative treatment in diseases like lymphoma, and it is also used in other diseases like multiple myeloma, plasma cell dyscrasias, and many solid tumors as well. The other form of transplant, which is more widely used, is called allogenic stem cell transplant. In allogenic stem cell transplant, we need a healthy donor to donate the stem cells to the patient. Allogenic transplant are divided into three types. The first type is a matched sibling donor transplant. For that, you need to have somebody in your family, which is most preferably a sibling, which have 10 by 10 HLA match with you. So among siblings, there are 25% probability of finding a full match. The second form of transplant is called matched unrelated donor transplant. So in India and across the globe, there are certain registries that store the HLA typing of the people. So these are all NGOs that store the HLA type, and whenever a patient needs it, they need to feed in the HLA report of the patient to these NGOs, and they come up with the prospective matches. So when we find a matched donor from the community, the type of transplant we do is called a matched unrelated donor transplant. In India, there are a few donor registries doing very good work in this field. The third type of transplant, which have really come up in a very big way recently, is haploidentical stem cell transplant. So for every individual, the parents are haplomatched, that is 50% match, because an individual is born by contribution from both the parents. So by default, parents are haploidentical match. So this 50% match donor are also used for transplant now. Also, somebody's children are also 50% match, because as parents are 50% match, so are children's. So these haploidentical donors are very readily available. So in certain diseases in which the transplant cannot wait, like in malignancies, haploidentical transplant have really come up in a very big way. So with the advent of transplant technology, these kind of transplant, which was very risky earlier, have relatively become much safer now, and it has become a standard of care in treatment of many blood cancers. So the common diseases for which we do allogenic transplant are, number one, genetic diseases. We all know in India, thalassemia is a common disease for which allogenic transplants are done. But for thalassemia, the standard of care is doing a matched sibling donor transplant. The other form of transplants in thalassemia is now evolving and has become a clinical option because of improvement in the technology. Other diseases for which we do allogenic transplants are sickle cell anemia, inherited bone marrow failure syndromes like aplastic anemia, primary immunodeficiency diseases. Those are seen in children, which can be cured with allogenic transplant. So what we need to know is all these genetic diseases can be cured with allogenic transplant. Among the malignant diseases, the most common disease for which we do an allogenic transplant are acute leukemias or blood cancers. So at some point in time, the blood cancers reaches a stage where the only curative option available becomes a stem cell transplant. So commonly, acute myeloid leukemia and acute lymphoblastic leukemia are two common indications of doing and allogenic bone marrow transplant. Other than that, there are diseases like myelodysplastic syndrome, myeloproliferative neoplasms like myelofibrosis, and then lymphomas, for which the first line treatment is autologous transplant, but if that treatment fails, allogenic transplants are undertaken. So the point to understand is allogenic transplant has really come up in a very big way in India. The results in India are matching the global standards. The pharma companies have come up with many generic molecules which has made transplant relatively cost effective in our country, as well as the advancement in laboratory technology in our country is also making all the standard and all the essential lab tests required for the conduction of transplant available in-house, in the city, in the country, making the transplant process smooth and successful. So that's all I need to say about transplant. Thank you.